With most businesses shuttered and large swaths of the country under some form of lockdown, the numbers were not totally unexpected, but still managed to deliver a gut punch.
Well, we're clearly living in something the likes of which we've never experienced in our lifetimes, and in some ways never in our history, because what's quite unique, and we're all living it every day, is that aspects of the economy have been brought to a stop. This is different from the financial crisis and recession, where we're talking about diminished economic activity. Back then, you could at least go out and buy a car if you wanted.
The US has seen 113 months of consecutive job growth before the pandemic gutted what was largely a booming national economy.
It is important for us to recognize that the surge in unemployment claims is an intentional policy response to the public health crisis. But the question is really, when will unemployment claims start to moderate, and to what level will they slow down to? Because that will signal whether these are just temporary layoffs or whether businesses are actually going out of business and actually permanently laying off workers. That's the concern for the long term. Are these layoffs just temporary, or when this crisis is over, will people be able to get back to work pretty quickly?
As arresting, the public health emergency becomes more critical by the day, not merely due to the economic impact, but the escalating COVID-19 caseload at close to 250,000 confirmed and more than 6,000 deaths and rising, with a new advisory issued for the country's epicenter.
We're advising New Yorkers to wear a face covering when you go outside and will be near other people. So let's be clear. This is a face covering. Again, we'll talk about the details in a moment, but it could be a scarf. It could be something you create yourself at home. It could be a bandana. It does not need to be a professional surgical mask. In fact, we don't want you to use the kinds of masks that our first responders need, that our healthcare workers need. Don't use those. I can't be clearer. Leave those alone. Leave those to the people who need them the most, who are saving lives. But you can create a face covering with anything you have at home right now, any piece of cloth.
With the US facing a dire shortage of protective gear, officials have advised healthcare workers to reuse and clean their disposable masks and gloves, rather than throw them away after each patient.
There won't be anyone left to take care of the public.
Nurses taking to the streets in protest outside this New York hospital.
This is outrageous that we have people coming and sewing things for us, sewing masks, sewing shields, making things out of plastics. This is what we're doing now? How? I mean, that would be like a soldier going to war and making a plastic gun to bring with him. This is what's happening. This is what we're doing. This is the situation, and the public needs to know, because they have to demand that we get the things that we need so that we can take care of people.
With numbers expected to surge in the coming days, the shortage of equipment, including ventilators, could further complicate efforts to save lives. The federal government announcing Thursday that it was invoking the Defense Production Act, an emergency statute that allows the government essentially to mandate that domestic private manufacturers produce materials and equipment that are in short supply, bowing to pressure from governors, mayors and health practitioners around the country who've been calling for this for weeks. Sherwin, Bryce-Pease, SABC News, New York.